what role does the international community, including the World Health Organization, need to play in preventing the collapse of Lebanon's medical infrastructure?
So today, I would like to thank all the different countries to Lebanon, and there are so many, from Iraq to Jordan to Egypt to France, to Canada, and to the Emirates. And today we have received donations from France and Qatar. So all those countries have started since the first week to send medications, to send supplies, to send food, and everything displaced people are in need. So these donations have helped us to redo our stock in medical supplies, because we can imagine how much 10,000 injured people have consumed from the drugs and the medical supplies we had in Lebanon. So those donations today have helped us to increase the capacity of our hospitals to be able to receive and to treat the coming shocks, or the coming attacks, and the new injured people. So at the same time, international organization, international communities, and medical communities are preparing themselves to send doctors, because at the same time we are in need of specialists, of experts, of doctors, particularly involved in the management of war injuries, like a plastic surgeon, like vascular surgeon, like orthopedic and neurosurgeons. And we are preparing now the ground to receive them in order to help, because those 10,000 injured people, of course, they have been treated initially, but now they are going into a long journey of treatment, which may take weeks, months, or years before the final outcome and the final healing.
Dr. Youssef, I would like to build on what you said regarding how healthcare workers are being a target of the Israeli occupation forces as well. How are they coping with the relentless bombardments, and what support systems are in place for them amid the crisis?
Please, can you ask again?
Yes, of course. I was asking about the healthcare workers. How are they coping with the relentless bombardments, and what support systems are in place for them amid this crisis?
It's about the bombs used in the attacks?
Used to target healthcare workers, since they are now a target of the Israeli occupation. How are they coping with this, and are there support systems in place for them?
As I have said, unfortunately, since the start of the conflict last October 2023, healthcare workers have been a target. But since September 17, hospitals, ambulances, doctors, primary healthcare centers, they become a direct target. And now, as I told you, 12 hospitals have been bombed, and around 100 primary healthcare centers now they are closed. So you can imagine how much this fragile system have lost from his capacity to treat people. And all now the burden is on the remaining system. So it is not too easy to sustain and to offer a good healthcare services. And now we are focusing on the acute injured people. What I can say that today our system is capable to treat injured people, since every 24 hours we have between 100 to 200 injured people. But if we we have more or the attacks create more and more injuries, we will be really in a difficult.
Thank you, Dr. Youssef. Thank you so much for all your fruitful insights.